Slides are being presented.
I'll present it afterwards. A hearty good afternoon and welcome to the session on PCOS and infertility. We are glad to have Dr. Swati Shree among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you. Thank you for the introduction. So, today we'll be discussing on the topic PCOS and infertility. And we all know it's a very important topic because the PCOS has become very common and it is one of the leading causes of the infertility. So, first of all, we'll know everyone is speaking about PCOS. PCOS, what is PCOS? So, PCOS is also called polycystic ovarian syndrome. It is a common condition in which hormone imbalance causes irregular periods, increased hair and acne, and may affect fertility. So let's see what how to identify if you are having PCOS or not. So PCOS is also called as PCOD, which is also called as polycystic ovarian disease or disorder. So these all are same almost. So now coming to incidence of the PCOS. So incidence is PCOS affects 1 in 10 women. That's a quite high incidence, and these are and it nowadays we are seeing it more and more often. So it's a common cause of female infertility, and 70% of women that have PCOS have not had it properly diagnosed, and less than 50% of the women are properly diagnosed, and more than 50% will develop diabetes. So PCOS is a hormone disturbance which has effect multiple effect on the life of a woman, and also has long term consequences like diabetes. So there are long term consequences which other consequences which I will be discussing further. So now coming further, what are the polycystic ovaries? So first of all, the polycystic ovaries are slightly larger than the normal ovaries and have twice the normal number of the follicles. So you can see in this photo or diagram that the normal ovary is having less number of the follicles, whereas you can see the polycystic ovary is slightly larger and the slightly more number of the follicles. So what are the follicles? Before also I have discussed it multiple times. So actually the ovary is a reproductive organ which contains eggs, and these eggs are released every month, and these are the eggs which meet with the sperms from the male partner this is called fertilization to form an embryo which is implanted to form a pregnancy. So every month one egg is released. So eggs are not present in the ovary just like that. They are present inside a small sac or small balloon of water, fluid filled balloon inside that. So this balloon is called follicle. So normally 6 to 8 or 10 follicles are present in every woman, and that is considered to be normal. In polycystic ovaries, what happens that these follicles are more in number. So they are slightly larger number or twice the number of the follicles they have. So they will be having 12, 14, 16, 18, 20, multiple number of the follicles, whereas less than around 10 till 10 it is caused to be normal. So it's not the cyst, there are not the multiple cysts, they appear as cysts. So cyst is also any structure which contains fluid is also called the cyst. So that's why the name is like that, but it is just a misnomer. It's the large number of follicles. So it is basically a polyfollicular syndrome. There are multiple follicles, it's not the cyst. So these actually are the follicles which are larger in number. That's why they do not do the purpose which they are to do. So now coming to symptoms. So what are the symptoms of PCOS or polycystic ovarian syndrome? In this, most common symptom will be irregular periods. So irregular periods, which is there, or sometimes there will be no periods at all. This can there can the woman can have acne, increased hair in the faces, in the other parts of the body, and there is weight gain. The woman may tend to be overweight, or there is sudden increase in weight, or they find it difficult to lose the weight. So these are some of the features, hair loss, and one of the features sometimes may be infertility. Not all the PCOS women will have all the symptoms, and not all the PCOS women will be suffer from infertility. So it's a human body. The changes and variations are always there. Now coming to how to diagnose. So there is a certain criteria for the diagnosis of PCOS. Just by seeing that someone is overweight or just by seeing that someone is having acne, we cannot say it is a PCOS. For the proper diagnosis, it is a criteria, and when a woman fits in this criteria, then only PCOS is diagnosed. So the diagnosis is made when you have two of the following features. So the of the following features, two features will be like irregular or infrequent periods, or no periods at all, or there is an increase in the facial or body hair, and a blood test that show higher testosterone levels than normal. So this is a feature. So the testosterones are the male hormones or androgens. So in females the level should be less. If they are higher, the those females tend to have in more facial hairs and the body hairs. So either they are present by the look, or when we do the blood test we find level to be higher. So this is one of the criteria. And the ultrasound scan that shows polycystic ovaries. So polycystic ovaries, what I showed, what I told, like in the last slide, the image was there when the number of the follicles, the ovaries are big or having the multiple follicles. These are called the polycystic appearance. Like this will be the appearance, there will be multiple follicles. So the features irregular, infrequent periods, or no periods at all suggest that there is egg is not forming every month. And when the facial hair or the body hair is present, or acne is there, or we see the blood test for the androgens or the testosterones, we do the blood test for that, or we do the scan. So these are the three features which should be present, and if any two is present, that is the criteria for the diagnosis of PCOS. What are the long term consequences? So PCOS does not have only the impact on the periods. They do not only make the irregular or no periods at all. They do have the long term health effects. So I will be discussing these, and then we'll discuss the fertility. So now the long term consequences can be, they can diabetes. So the women with PCOS are at least 1 to 2 times at a higher risk of having PCOS. So 1 to 2 in 10 women develop PCOS in the long run. So why? Because somewhere in the development of the PCOS, the mechanism is that the body is becomes resistant to the insulin. So we all know insulin is the hormone which is responsible for the metabolism of the carbohydrates, that is sugars what we intake. So whatever sugars we take, that metabolite, the metabolism of that means the use of that by our body depends on the hormone insulin. So insulin hormone is present, but the receptors are not able to respond to that. That is called resistance. So when that happens, the diabetes develops. So most of these women in a long run tend to develop diabetes. So that is one of the important long-term effects of the PCOS. Other effect is gestational diabetes. So gestational diabetes is diabetes which is there in pregnancy. So the women with who are having PCOS also have other they tend to have diabetes in pregnancy. So hence any woman having PCOS, they will be checked for the development of the PCOS for the diabetes in pregnancy. Like around, if they don't have diabetes, we'll check at around 24 to 28 weeks to look for the presence of diabetes. So the blood test, sugar test will be done for them. They are also at high risk of high blood pressure and heart diseases. So and especially the diabetes and the high blood pressure and the heart diseases, these are more in those who are overweight or they have a family history. So these are the risk factors which increases the risk of these long term consequences. Other is that the depression and mood swings because of the irregular periods, because of the overweight and lots of the problems. So these all as a combined have a psychological impact in the woman, and psychological impact or stress also has a lot of impact on the fertility of any woman. So and the other impact is snoring and daytime drowsiness. So and these all are because of the all the metabolic effects that are being produced because of the PCOS. Another is the endometrial cancer. So because in the PCOS, because there is hormonal imbalance, there is too much of the hormone estrogen, and this estrogen causes too much thickening of the lining of the womb, and that is responsible for the endometrial cancer. So these all are, this is responsible. Hence, it is said that a woman with PCOS, if they are not having any periods, then they should at least get periods once in 3 to 4 days, 3 to 4 months, sorry, so that whatever extra lining they have gained, that should be shed out. So that decreases the risk for endometrial cancer. So that's important to have periods at least once in 3 months. So these are consequences of the PCOS. Now coming to impact of PCOS on the reproductive health. So what are the impact? So PCOS, as we saw in our first slide when we introduced the PCOS, I told that it is a disease, is a condition of hormonal imbalance. So the hormones are imbalanced. So in reproductive life, the female the infertility is caused because of there are the ovulatory factors. That means the ovulation doesn't happen, that means eggs are not released. It happens in 40% of the women who are infertile, or though in those women in whom the female factor has been identified as the cause of infertility. Some other 40% are like the tubes, if the tubes are blocked, or sometimes in 5% of the women the uterus might be having abnormal, and in 15% it is unexplained. So out of these 40%, that means out of the 100 women who have infertility, those 40 women who are having the ovulatory disorder, that means they are not being able to release eggs, 85%, 85% will be because of the PCOS. So it forms a major, a bulk, a big chunk of the causes for the female infertility. So what now coming to how does it impact the fertility? So it has impact on the hormones. It causes imbalance, which I told earlier. So like imbalance is what there. So from the brain, the two hormones are secreted, which are responsible for the growth of the eggs inside the follicles. So follicle is the fluid-filled bag in which eggs are there. So during a menstrual cycle, the eggs are maturing. So every month one egg's matured. When it's mature enough, the egg is released. So when the egg is released, so that to happen, that the hormones are working in a synchrony. So there are the hormones FSH and LH. So most of the women with PCOS, it has been found that the LH is higher than the FSH, where as you can see in the other half of the slide, on most of the women without PCOS, that is normal women in whom there is no imbalance, the FSH LH will be almost balanced. So they are almost in equal proportions. The LH is not that higher, or if it is higher, the FSH might be a little higher than the LH. And these hormones also change their level with the cycle, because a cycle depends, there is a cyclical change of these hormones. So initially FSH is high so that the follicles grow, and then the LH becomes high so that the egg is released. So this is the whole cycle which goes on. So these FSH and LH hormones are being secreted by the brain. From the brain, the gland called is the pituitary gland is the gland which secretes these hormones. So there is hormonal imbalance. This LH FSH is got imbalance, which causes imbalance in the other hormones like estrogen and progesterone. So these are the problems which are there in the PCOS. So as a result of these problems, what happens? The follicles are good in number. The follicles are not less. They are there. Eggs are there. But every month, one egg has to mature and it has to get released, which is not happening in this case. So when the egg is not released, their eggs will not meet the sperm, and there will be no fertilization and no pregnancy. So this is the major problem because of these hormones. So and also when the eggs are not forming, there is no much good secretion of the estrogen and progesterone. So the lining is also not very much well prepared inside the uterus or womb to take the pregnancy. So these are some of the problems which is there in PCOS. Now coming how we overcome these problems. So most important management of PCOS is lifestyle changes. So actually, PCOS is nothing but a lifestyle disorder. With change in our lifestyle, with change in the sleeping habits, with change in our fooding habits, more of the preservative foods, the totally change in our life scenario. We have our sleep wake cycle. We have our body is accustomed to have a wake in daytime and sleep at the night time because of the work pressure, the time changes, everything. There is so much changes in our life which has all caused this disorder. So that's why we can see that the more and more number of people are coming with the women are coming with these problems of polycystic because of the lifestyle changes. So we need, it's a high time that we need to go back to the original lifestyle, what we should have. It's so the important, most important management for PCOS is lifestyle changes, like having a healthy diet, having a healthy weight. I mean, it's very important to maintain a healthy weight, and wish and yoga, meditation, exercises, nutrition, all play a very important role. And it has been found that if a woman reduces even a small amount of weight, many women experience the regular cycles and start having ovulation, start releasing eggs, and they can have their spontaneous pregnancy. So this also is possible, and many women have experienced this and have gone through this. So it plays a very important. So that is why the lifestyle changes becomes the first and foremost management. I know the weight loss might be a little difficult in these women, but with proper diet, with proper consultation with the dietitian and physiotherapy, yoga, and proper consultation with your doctor, this all can be solved. So these all, if we change this, we can overcome a major hurdle. Now comes the further if management is, if it's not happening, or if they like, if we are finding that there is no egg release, the another method is ovulation induction. So ovulation induction is like, we will give medicines like tablets or injections which will regulate the hormones which are secreted from the brain, so that the eggs are maturing properly, eggs start maturing and releasing. So that can be started. So that is called ovulation induction. So in that, what we do, we give you sometime tablets, some women respond to the tablets and start growing eggs, and then we give some injection so that the eggs which has grown or matured gets released. So that is called ovulation induction. And when your doctor is offering you ovulation induction, they might also offer you some scans to look for that if the medicine is affecting or not. So if we do the scans to see the eggs are growing, that is called follicular monitoring. And when the eggs have grown an appropriate size, then the injections are given, which also simulates the hormone secreted from the brain, so that the eggs got released. So this releases the egg. So this is called ovulation induction. And when we give the injection start for the egg release, many women might respond to this, and many women get pregnant with this method. So this is an important treatment for many of the women with PCOS. But many of the women might not be able to respond to even these medicines or injections. So injections are also the hormone injections which are given, and then we see for the response, and accordingly we decide for the dose and further management. Many times, if there is no response, your doctor may also advise you some surgery, which is called ovarian drilling, and it is done by laparoscopy. So, what happens in this laparoscopy? So, in laparoscopy, it is a keyhole surgery in which small cut are made in your tummy, and small camera, thin camera is introduced, so that we can visualize your ovaries, your tubes, your uterus, and we'll see for the ovaries. And if there are so many follicles, these few of the follicles are destroyed, so that the hormonal imbalance gets balanced. So that is one of the procedure, and many women start responding even after that procedure. So if you are not responding to the tablets or the injections, your doctor may advise you sometimes this. And sometimes some doctors may also advise give you some tablets for the which are the tablets given for the diabetes. It is not for the diabetes, it is to reverse the process of insulin resistance, the that improves the many people start ovulating even after that. So that is also one of the medicines which can be given, and this is the surgery. Many times, if depending upon the patient feature, the characteristics, and what is the previous response, your doctor may decide upon any one of these. Now, coming to next, like if nothing has worked out, the last resort or treatment can be in vitro fertilization, also called test tube baby treatment. What is test tube baby treatment? So, in test tube baby treatment, just like ovulation induction, will be giving you injections and tablets. Mostly, the injections are given, and these are the injections of the hormones which our body naturally secretes. So, we'll giving the injections from the outside in the form of the injections, and these are the pure hormones which we inject, and they cause response. So, we our main aim is to grow multiple eggs, so that the multiple eggs start growing, and when they are mature enough, in place of giving injections to release the egg, we give the injections to make it more matured. But in place of just before they are released, we do a small procedure, and in which the we collect the all eggs, and all the eggs are mixed with the sperms of your partner, and the resulting embryo which is formed is later on transferred inside for your womb. So this is the procedure of test tube baby. So this is one of the steps which in treatment which can be done in PCOS women. If other treatments of the lifestyle changes of the ovulation induction all has failed, then we can also go for this. It's because many times if they are not responding to the lower doses of the tablets, then they might respond to the hormones which are directly given. So this is one of the treatments. So now to summarize my what I have told, PCOS is basically a hormonal imbalance, and it is a lifestyle disorder. Changing and improving your lifestyle can improve your condition, and you might have a spontaneous pregnancy, because the main problem in these conditions are the hormone imbalance. Even some people might be very thin also, so it's not like the only the losing weight impacts. Having a healthy active life also has impact. If you are thin and also having PCOS, it's not mean doesn't mean that you need to lose weight, but you need to have a healthy life. You have need to change your dietary habits, you need to change your daily activities, you need to be more active, you need to be start doing exercises, yoga, and all these can definitely affect your hormones. It can improve your balance and help you in getting pregnant. And also those who are overweight, if they lose the weight with, they might start ovulating, they might start getting spontaneous pregnancy. And if they are going for any treatment, also does impact, because if the weight is less, the lower doses of the injections are required for them, and also they have get better results, that they have better response to the whatever treatment we are giving. And also we find that the success rate of the test tube pregnancy also is better. So overall, it's an high time that we need to look for our health, and whatever lifestyle changes is having effect on our health, we should change, because PCOS is not a disorder or problem of present, it is also having a long term effect. So that's what I had to tell about the PCOS and its impact on infertility, and also impact on the future life. Thank you all. If you have any queries, you can put it in the box, and I will be happy to help to answer your queries.